mynews.studio.
Picture this: a child's clinic in Egypt, a courtroom in Portugal, and a village in Kenya. At first glance, they seem worlds apart. But what's the thread that ties them together? And more importantly, is there finally enough momentum to end female genital mutilation for good?
Today's date is February 18th, 2026. More than 230 million women and girls alive now have experienced female genital mutilation, FGM, in 94 countries. That figure is much higher than we realized before. Why are we seeing such a jump in the data right now?
It's because of new research published early last year. Investigators uncovered FGM cases in countries we hadn't previously linked to the practice. Places like Azerbaijan, Cambodia, Vietnam, Colombia, Malaysia, the Philippines, Saudi Arabia, Sri Lanka, and the United Arab Emirates. So, it's no longer an issue limited to a handful of African countries.
The numbers are stark. 4.5 million more girls at risk in 2026 alone. Many of them are under 5. Could you walk us through what FGM actually involves and why it causes so much harm?
FGM is the partial or complete removal of external female genitalia for reasons that aren't medical. It's rooted in gender inequality. The consequences are severe: chronic pain, infections, psychological trauma, infertility. It also raises maternal and infant mortality rates. Treating these complications costs over $1.4 billion a year. And if nothing changes, that could reach $2.1 billion by 2047.
Despite all this, the last decade saw a dramatic shift. Half of all progress against FGM since 1990, so more than 30 years, actually happened in just the past 10 years. What fueled such rapid gains?
It comes down to a mix of things: community education, new laws, religious and local leaders stepping in, and international collaboration. For example, 9 countries, Uganda, Togo, Ghana, Benin, Kenya, Nigeria, Central African Republic, Chad, and Ethiopia, have all seen steep annual declines.
Legal changes have real impact. Since 2020, Sudan, Indonesia, Finland, Poland, and the US all passed federal bans. Portugal, the Gambia, and the UK have had their first successful prosecutions. But it's not all progress, is it? There's a new risk now, right?
Yes, medicalization. Now, about 2/3 of girls who undergo FGM have it done by healthcare workers, especially in Egypt, Indonesia, Kenya, and Russia. There's a mistaken belief that it's safer, or even acceptable, if it's done in a clinic.
So, the same people who are supposed to protect girls are sometimes performing the procedure. How are health systems dealing with that?
The World Health Organization and others now have clear guidelines. Healthcare workers need explicit bans in their codes of conduct, plus training to become advocates, and survivor care protocols. Communication that's person-centered is essential. It directly addresses the beliefs behind medicalization.
But enforcement is inconsistent, right? Only 58 out of 94 countries with FGM have specific bans. Even fewer actually prosecute. What about funding? Where's the money going?
Most international funding is still aimed at a handful of African countries. But as the new data shows, FGM is widespread in Asia, Latin America, and the Middle East too. To be effective, funding needs reliable data, steady long-term resources, and direct support for grassroots and survivor-led groups.
Some governments deny FGM even happens in their countries. That must make it almost impossible for local groups to get support, or for survivors to get help.
Exactly. Without reliable funding or government acknowledgement, prevention efforts shrink and frontline services weaken. That leaves millions more girls at risk, especially with just 4 years left before the 2030 Sustainable Development Goal deadline.
Let's look at what is working. How have survivor-led organizations and grassroots campaigns changed things on the ground?
Survivor testimony has changed everything. Their voices have been crucial in legal victories, like the first FGM prosecutions in Portugal and the Gambia. Even when there were efforts to repeal anti-FGM laws, such as in Kenya and the Gambia, grassroots resistance made sure those laws held.
And there's been a real shift in attitudes, too. Now, 2/3 of people in countries where FGM is practiced support ending it. That's a major turnaround. How did it happen?
It's about engaging trusted voices, religious and community leaders, parents, teachers. Both traditional and social media have played a big role. When those voices lead the conversation, people listen. External pressure by itself isn't enough.
Are there lessons here for other human rights movements?
Absolutely. Center survivor voices. They bring both moral and practical authority, work closely with local leaders, commit to long-term cross-sector approaches, build grassroots movements, and collaborate internationally. And when there's pushback, form broad coalitions to protect gains.
So, what we're seeing in the fight against FGM is that progress is possible when survivors lead, communities engage, and international support is consistent. But do we have enough time before 2030?
That's the crucial question. The past decade proves change can happen. But if funding or commitment falters now, millions more girls will face preventable harm.
We've covered a lot: the expanded scope of FGM, rapid progress and setbacks, the risk of medicalization, funding challenges, and the impact of survivor-led change. The road forward is clear, but time is short.
Thank you for joining us. This episode was brought to you by mynews.studio. Try it now for free.